Good morning, dear audience. In this presentation, we shall talk about my beginning in oncology and the increase of cancer in the 20th century. And in further presentations, we shall discuss about the treatments, standard treatments of cancer, and also some additional metabolic treatments that will help the standard treatment of cancer. I shall start with my education. My childhood and teenage period passed in Izmir. Izmir is a province of Turkey. My late father, was a prosecutor in Izmir, so I was lucky to be educated in my early years in Izmir. I finished the French College Saint-Joseph and İzmir Atatürk Lisesi in Izmir, and in the year 1950 I went to Istanbul where I would start my university education, because at that time there were no universities in Izmir. From 1950 to 1956 I was a student in the medical school of Istanbul University. At that time, we had also the good luck of having many German professors who had run away from Hitler in the 30s and 40s. So we had a good medical education. And that means that I am a 61 year, I have a 61-year professional life. I am a 61-year medical doctor. Okay, then when I graduated in 56, I was accepted as an assistant in the Therapeutics Clinic and Pharmacology Institute of Istanbul University. There I worked many years, where I got my diplomas of internist, my diploma of hematologist, and my diploma of associate professor of internal medicine at this institution. My professors were Professor Sedat Tavat and Professor Reşat Karan, who were also very, very important professors, and I owe many of my qualities to them. At those years, in the middle of the 20th century, cancer was becoming apparent, because in the beginning of the 20th century, cancer was a rare disease. As a proof, I shall mention you the autopsy results of Heidelberg University pathology department. This is a very serious institution, and they were doing careful autopsies of the dead people. So, as an example, we shall give you the lung cancer autopsies in the last century. You see, from 1841 to 1875, there were only 2 cases of lung cancer. Then you can see that as the years pass and as the 20th century comes, the figures increase. I shall mention only the last one. From 1951 to 1963, there were 589 cases, which is very apparent that cancer is increasing at an important rate. The same thing can be seen also in this ladder of cancer mortality. You see, here the beginning is 1900, and these are the mortality frequencies of cancer in proportion to death number. So you see that in the 1900, there were only 3.3% of deaths were due to cancer. When you see the ladder according to the years, when you come to year 1960, the 20.9 of deaths were due to cancer. So you see how in 50 years, in half century, what happened to cancer incidence. Again, another figure from United States. This is the graphic taken from the Terry report. Terry was Surgeon General in United States in the years 60s, in the 60s years, and I think President Kennedy had chosen him as Surgeon General, and you see that through the years, from 1900 to 1960, you see the increase of cancer. And here they have analyzed also the increase according to the population increase, according to the prolongation of life increase, but still there is a gray area which is due to properly other reasons that increase cancer incidence. So you see, we can see from here that cancer is a very important threat for public health. So, in the year 1972, I took a sabbatical leave from my university, and between 72 and 74, for 2 years, I have worked in Rochester University in New York, and I had training in medical oncology and radiation oncology. The boss was Philip Rubin in radiation oncology, who was an eminent radiation oncologist in the States. He was the chief editor of American Radiation Oncology Journal. And for medical oncology, Richard Beckmeyer was the chief. And I have learned many things from these two eminent persons. In 74, I returned to my country, to Turkey, and in September 74, I applied to the university for the institution of medical oncology as a separate department. And it was accepted by the university administration. So we started from September 74 as a separate department, where we had education for students, for physicians, and we have educated many specialists and many professors from that unit. Again, I have founded the Society of Chemotherapy in 1983, and I have founded the Turkish Medical Oncology Society in 1995 with many valuable colleagues. In 1987, we have organized with great success the 15th International Congress of Chemotherapy, where 6,000 people participated. And so these are our main historical cornerstones. Today, I don't know exactly how many medical schools are in Turkey, but I know that at almost each of them there are medical oncology sections or departments where valuable colleagues are working in the service of Turkish people. Thank you.